Good afternoon. I'm George Latimer, Westchester County Executive. It is Monday, November 30th, and this is the first of our updates this week for the Westchester coronavirus outbreak. We have come to the last day of the month of November. Tomorrow will be the 1st of December. We began Westchester's direct involvement in the COVID outbreak on the 1st of March, first case on March 3rd, so we are now completing the bulk of the year, a 10 months period of time in which we're dealing with this pandemic. And the numbers here that I'm going to report on today continue to show a sharp rise in the amount of infection in Westchester County. That is numbers that you're seeing similarly around the country, not limited to Westchester County, not limited to New York State or the metropolitan area. But now we have a pandemic that is, in fact, felt in every corner of the United States of America. Perhaps back in the spring, we were ground zero for a while, and then other parts of the East Coast, Northeast Coast were, but now we're seeing this in rural parts of the country as well as in urban and suburban parts of the country. The numbers in Westchester continue to rise. They continue to be alarming numbers. As of today's numbers, just retrieved from the New York State Department of Health Tracker, we have 6,117 active cases of coronavirus in Westchester County. Now, you won't see that number on a particular graph on the tracker. That number is obtained by taking the number of total positives year to date, which is over 50,000, and subtracting from it the number of cases we had 2 weeks ago today. That would represent the cases that have developed just in the last 2 weeks, and that number is 6,117. That is a tremendous number. 1 week ago, we had 4,808 active cases. That's an increase of 1,300 active cases in the last week. If we go back 2 weeks ago, the number of active cases was 3,515, and now we're at 6,117. And if you want to go just a month ago, the day before Halloween, October 30th, we had 1,393 cases, so that is an increase from that day to this day of almost 4,000 active cases, as we've seen here in the month of November, and we saw as well as the month of October. COVID infections are rising dramatically. As we test, we are finding a higher percentage of people that have the coronavirus. Our infection rate for just the testing that was done in the last 24 hours was 5.6% of all the people tested came down positive with COVID virus. The number on Sunday's testing was 4.7%, Saturday 5.0, Friday 5.2. And at the 5% ratio, we are seeing a significant increase then in the absolute number of cases that we have. We had a period of time throughout a long stretch of the late spring, summer, and the very beginning of the fall, where our infection rate was under 1%, meaning 99% of the people who tested did not have the virus. 1% or less than 1% did. We are now showing 5%, high 4%, 5% numbers. That is a multiple of 5 from when we were at the lowest amount. So even though 95% of the people, 94% of the people are not testing positive for COVID, even 5% testing positive for COVID is generating a spike in the number of people infected. So we have 6,117 active cases of COVID as of today, Monday, November 30th. The last information we have on hospitalizations dates back to Saturday, where we had 244 people hospitalized for COVID in Westchester County. A week ago, we had 168 people hospitalized. The week before that, we had a total of 121. So that number 2 weeks ago, people hospitalized for COVID, people who have COVID and have it severely enough to go to the hospital for treatment, has doubled from 121 people to 244 people over 2 weeks in hospitalization. If you go back a month ago, October 30th, we have 48 people in the hospital. So that number is an even greater multiple of where we are today at 244. We've increased over 200 people that need hospitalization because of COVID-related situations. And unfortunately, the death toll follows that degree of hospitalization. We have lost a total of 1,515 individuals to COVID. A week ago, that number was at 1,500, so we've lost 15 people in the last week. In the last 2 weeks, we've lost 25 people in the aggregate, and you go back a month ago, in the last month, we've lost 42 people to COVID. And I've made the statistic that 2 months aggregate during the summer into the early fall. We lost a total of 11 people. We have lost 42 people in the last month to COVID here in Westchester County alone. The last time we had as high a number of active cases as we have today, because we had a peak in the early part of the spring, and then it dropped down dramatically for a long period of time. The last time we had these many active cases, it was May the 3rd. And the last time we had these many people hospitalized for COVID was May 31st. So if you consider whatever progress we made in June, July, August, or September, even October, we are now back to May-level numbers of infection, of active number of cases, and of hospitalization. This is not a rosy picture. As I often say, I'm not here to sugarcoat reality, nor am I here to fearmonger, but just to give you these statistics as we know them. And so this does show a significant increase, and it has now been a steady increase. This is not the first Monday update that I've told you the numbers are bad. It's probably 5-6 weeks in a row that I've had the same basic news to deliver, and it's worse each Monday over the prior Monday. Now, we'll be reporting again on Thursday of this week. We are in the process of receiving now more detailed statistics that we can share from different municipalities. We have had a link through information technology that takes state data that was available to the state, not available to the county, that is now available to the county. We just have to figure out how to process it into a regular report so that we can report to you on a daily basis what's happening specifically by communities. And we hope sometime in the next week, hopefully no more than 2 weeks, we'll devote attention to that. We are dealing, however, with this spike in COVID at a very urgent level, and the state is certainly dealing with it on an urgent level. Governor Cuomo had his press conference earlier today, in which he had representatives of the various major hospital associations. Greater New York Hospital Association, Hospital Association of New York State representatives were present. Michael Dowling from the Northwell conglomeration of hospitals was present and spoke. And then also I was there along with a number of other county executives listening in as part of the discussion. Well, the governor laid out today's state priorities in terms of COVID. Number one is to manage the hospital capacity. As we start to see the rise in hospitalizations, we now start to think in terms of having sufficient hospital beds, sufficient PPEs, and sufficient professionals to be able to deal with the rise in the serious illness of COVID. When we have a certain number of individuals that test positive for COVID, that does not mean that they are sick, nor that they're dangerously sick. They may be able to fight it off with their antibodies. They have a fever. They may be home a couple of days. But when they reach the point at which they need to be hospitalized, and that may lead them ultimately toward intubation, if that's necessary, ventilator to keep breathing, that type of circumstance, that degree of illness is much greater and much more to be concerned. So the hospital capacity is important. In Westchester County, we have 3,000, in round numbers, 3,000 hospital beds, 244 patients hospitalized for COVID against an inventory of 3,000 beds is not a concern. We've not reached the 10% mark yet, so we are not in concern of overcapacity. The hospitals have a wide variety of other illnesses to deal with. They have elective surgeries that are necessary. People who, my age category need new hips, new knees, and so forth. So that capacity still continues on. We had a call today with the various hospital representatives, and I'll cover that in a little bit. But one of the things that they talked about is at this point, there's sufficient hospital inventory to manage what the rise in COVID cases has represented for Westchester County. But the state priorities: manage the hospital capacity, make sure that there is a balance of testing so that we're testing all elements of the society, and particularly as relates to the next bullet, which is in a quest of keeping our schools open to the greatest extent possible, that there be testing capacity set aside to ensure that by testing school students and the people who work at various schools, both teachers, administrators, and other support staff. State has laid a priority out to stop the spread from small gatherings, perhaps the hardest thing to do, as we now go through a complete 9 months of pandemic. We all have pandemic fatigue, following the discipline that it takes not just to wear masks, but to avoid being close personal contact with other people that aren't part of your immediate family. In your circle, that guard has dropped. More and more people, want to have that contact. It's holiday season, certainly Thanksgiving, certainly Christmas holidays coming up, and the spread from those small gatherings are particularly concerning. And you have to recognize we have basically shut down all societal group activities that are not related to individual families. We don't have parades. We don't have ongoing group meetings. Almost every organization you could think of is meeting via virtual methods. We're, not celebrating sports. We're not celebrating religious holidays in the same way. We're doing it, but we're doing it at a minimum level. So it is not the public events that we can control by canceling or changing that now is at hand. It's the individual actions of those individuals who do not show proper protection against the virus as they function in their life. And the state has also prioritized that they would prepare for an equitable and safe vaccination program. I'm sure when that rolls out, the county will be a principal in that to be assistant and help administer it. We're not yet there. We see the light at the end of the tunnel, but it's still at the end of the tunnel. It's not as proximate as we would all hope for. We would hope that we'd be able to disseminate vaccines immediately, but that will come in some time, most likely in the first part of next year. We've had 2 occasions today here in the county government to have group meetings with the various school superintendents. The safety of our school students is very much paramount in our mind. Under normal circumstances, the county government has no supervisory responsibility over schools. School districts separately incorporated in every community except for Yonkers, where the city government manages the school function. Those independent school districts report directly to the state education department at the state level of government. But because the challenge of dealing with COVID to remain COVID-free, public health issues, testing and all the like are as complicated as they are, no school district is prepared for that. They don't have the manpower nor the resources to do that. The county government has stepped in to be a partner with those school districts and to try to help interpret, what the state is mandating for us and to try to help accomplish that so that we can do the testing and we do the protocols necessary to the greatest extent for schools to remain open. We started a relationship with school districts back in March, and we've now had an every Monday morning meeting at 8:30 with a group of school superintendents of the 44 districts, and we have some other organizations that sit in with us as well. As it stands right now, the governor made no announcement today that either adds to or extends the yellow zone designation in 5 of our communities and the orange designation in 1 of our communities. Now, these zones do cross municipal lines, so we have a yellow zone that is Tarrytown and Sleepy Hollow. The initial one in Port Chester does include some of Rye Brook at the yellow zone level, Port Chester at the orange zone level, and that may be true as we deal with others in the future. But we have 6 zones that have been applied. No additional ones were added today. We are looking to see if there'll be action on Wednesday. It has been traditional that the state has acted to designate zones on Wednesday. And there are rumors that with the numbers that we're showing, the high increase in the amount of infection, that we could very likely have some additional zones structured in yellow. And we could very easily have the whole county awash as far as orange zone considerations, which is the intermediate level of concern and control that the state has established. So what the state did do today, announcing what was new, which was done in some conversation with those of us who are county executives in our major counties, is to indicate that when an area goes from a yellow zone into the more intense orange zone, it is not an automatic shutdown of schools. The original protocol was that yellow zone, cautionary, schools can operate under testing. Move to orange zone and, of course, red zone, you must shut the schools down. That is not the case now. They've put out an understanding that an orange zone school can remain open, but over the course of a given month, they have to test 20% of their students and then, of course, show that the infection rate is sufficient that they can manage opening the school and maintaining it. That would be done in 2 half-month intervals of 10%. So if you have 100 students in your school, you have to test 10% of them in the first 15 days of the month, and in the second 15 days of the month, you have to test another 10% of the school. So by the end of the month, you've tested 20%. That's in the orange zone. The schools can remain open, assuming you hit those numbers, both testing and the results come back, and they are workable, manageable. Under the red zone, that number rises to 30%. So you have to test 15% in the first half of the month, and then an additional 15% in the second half of the month. And that will hopefully give us some idea of what the circumstances are and allowing the school district to stay open. The delivery of the tests will require the state to help through the county government deliver sufficient tests for these school districts to be tested on an across-the-board basis. As it stands now, only Portchester is in the orange zone, so we don't need to activate this system, but we are concerned there'll be a wide number of districts that might fall into orange zone if the numbers continue to rise. We'll see what happens through the rest of the week. But our second conversation today with the school superintendents, happened about 1 o'clock today, was to follow up on some of the governor's outlines, and we're trying to stay as ready as we can. We will be designating a senior manager here in our county office operation team to be working solely on the issue of working with schools and testing protocols, and to make sure that the schools have every opportunity to stay open. We know that the education of our young people is important, and we know that the health and safety of our young people are important, and we have to try to balance that out. We recognize that if kids are home, they are not getting the proper educational experience that they would get. Now, the question is, can you provide that in a hybrid setting where they're home some of the time, but not all of the time, or in an in-room situation? And that will depend on a lot of things, and things that we don't necessarily control directly, but we're going to try our very best to work through the testing module and do the best we can to try to keep those schools open. If we lose a year of education for our young people, it could be life-changing. Can create all kinds of problems for individuals that will manifest itself 10 and 20 years to come in our society. So we cannot blithely close the schools automatically without being fearful of some of the impacts. Excuse me just for a second. Excuse me again, I'm trying to clear my throat to be properly understood. So with the orange zone concerns, we'll see if more districts are declared orange zone, more communities are declared orange zone, if it affects more districts. If it does, the county government will work with the school districts to meet the testing protocol that was announced today by the governor. And we'll look to see the written protocol that will follow that. Now, orange zone designation just doesn't affect schools. If a community goes into orange zone, it has an effect on other parts of the society. It has an immediate effect on restaurants and dining. Outdoor dining is still permissible under orange zone, but indoor dining is not permissible, and the capacity per table is reduced. Under normal circumstances, if this were the summertime, moving outdoors, problem enough, but workable. Now that we're just on the cusp of the beginning of the winter season, much more problematic. The weather's colder, and it has been interpreted that when you have outdoor tents, you're physically outside the building. But if you close off those flaps and you create a closed-in area, which you do to try to maintain some warmth, you all of a sudden now have to meet indoor standards, and that may make it impossible to do that in the orange zone. So there's some discussion about this. We have our Commissioner of Health, Dr. Charlita Amler, talking with various local elected officials, various restaurateurs, parts of chambers of commerce, to help us interpret what the state has created as law through their executive order, whether or not these restaurants are going to open and survive. We know what we went through in the spring, and we know that when you drop back to just takeout, it's very hard for restaurants to survive. They are an important part of our economic engine. They employ individuals who may have difficulty finding alternate employment. So we don't want to see things shut down arbitrarily, but the spike numbers are ferocious. And we know that spread can occur in a restaurant setting. It can occur in a bar setting. And the ability for us to try to manage this disease to some degree requires us to address those issues. In an orange zone designation, only one at this point in Portchester, there is restriction on outdoor and indoor dining. So outdoor permissible, indoor not permissible. The regs may change. If they do, we'll certainly report that to everyone. In the red zone, you move in restaurants only to takeout. And there are no red zones at this point, but we fear that we may see some of that, so we hope that won't be the case. The capacity of groups drops down under orange zone and then under red zone. And very importantly, there are certain businesses that are deemed non-essential that could, under orange zone circumstances, be closed. That would be an action by the state, but we've been through this before. We've seen barbershops, hair salons, personal care facilities, I mentioned tattoo parlors, nail salons, and then in a separate category of activity, gyms and fitness centers, various exercise classes and so forth. All of those fit into the state's definition of non-essential businesses. which would close under orange zone designation. And then the same would also occur in the red zone. So we are looking at numbers that are not good. They're not good every week. They're, in fact, worse every week. And as we move toward these restrictive zones, we go backwards as a society toward more of a closure of the society rather than the opening of the society. That is why we do everything we can to appeal to your common sense. As tired as you are of wearing masks, as tired as you might be of sanitizing, as tired as you might be of being told you can't, be up close and personal in a large group of people, the more we do our own thing, the more we don't stop the spread of the disease, then the more likely it is that there'll be shutdowns of parts of our society which have an economic devastation to the individuals involved and to the society as a whole. Now, the calls with the schools, we had 2 of them today. We also had a call with our major hospital representatives. We're very appreciative of their hard work. And on the call were White Plains Hospital, Lawrence Hospital, New York Presbyterian Hospital in the Upper Hudson Valley, representatives from the Westchester Medical Center, and all the other medical institutions in the county. We've offered to work with them on the testing requirements. Many of them provide testing, but not at the level of large group tests that can satisfy some of the requirements that we're receiving. So we are going to have to help advocate through the state to allow more test kits to help accomplish the mission. We know that, as they described, they're experiencing a higher increase of hospitalizations, and they're concerned about staffing. And the governor today indicated that it was important for all of the hospitals to try to survey their staff and recently departed staff to try to get as many professionals, doctors, and nurses on the available for when they might be needed. And as we've talked about before, we did this back in the spring, if you have those medical skills and you are retired, if you stepped off of day-to-day activity, we encourage you to reach out to us, and we can try to loop you in because we're going to need your help. As these numbers continue to rise, it is going to be a concern for all of us to know how we're going to deal with it. The hospital networks are encouraged by the governor to spread patients out throughout their network. And so you have the Northwell Network, you have the Montefiore Network, you have the New York Presbyterian Hospital Network, all of whom have a presence here in Westchester County. When we say that we are not stressed in the number of beds based on Westchester's usage, we're identifying 3,000 hospital beds, 244 people hospitalized. That is not stressing our numbers at this stage of the game. But we are not an island. I've said this every time this topic has come up. We do not have a moat around us. And so if there are people who are sick and in need anywhere else in these hospital networks, anywhere in the Northwell system, which includes Northern Westchester Hospital and Phelps Hospital, anywhere in the Montefiore system, which includes units in New Rochelle and White Plains and other municipalities, anywhere in the New York Presbyterian system, which includes presence in White Plains, Bronxville, and up in the Peekskill area, that the emphasis from the state is that those hospital networks manage open inventory and move, as necessary, people in health need to where available beds are located. So if Westchester is at a low number of hospitalizations of our own residential patient list, then expect that an area that's overtaxed would have some of that shift to Westchester County. But our dialogues with the hospitals continue. When we complete this call in about an hour, we'll be on the phone with all of our municipalities. We will be talking with them, going over some of these topics and then some others that are germane to the local village, town, and city governments. We also have our state and county legislators in on the phone call as well. We have established individual calls for those communities that have either been designated yellow or might be on the cusp of yellow designation. In the last 2 weeks, we've had these phone conversations with Portchester, in fact, in a follow-up meeting, phone meeting today. Meetings also last week with Ossining and the Sleepy Hollow Tarrytown combination. And although not designated, we had one with Mount Kisco to anticipate one of the communities that does have a high number. In those things, we went over protocols for the help that the county can provide, educational help, PPE help, being able to avail ourselves and themselves of test kits, and be able to distribute those things into the areas of greatest need within each of those communities. We've also had the talent of Catherine Chaffee, our Director of Communication, who you see off camera all the time here when we do these updates, to provide some of the communications expertise, the flyers and the PSA videos and so forth. which the communications department here has done a really great job of. We made those available through the local different communities and in a way that shows local people in local settings. So the PSEA means something to someone who lives in Ossining and looks at an Ossining-based video in their backyard. All of these things are actions that we have to take as a county government, not because they are part of our original task, but they are the functional task of what a regional government is. We try to provide those services that the local governments cannot on their own provide either as efficiently or as thoroughly as we can. Local governments do a tremendous job of day-to-day police work, fire fighting and fire services in general, sanitation, pickup, curbside, and recyclables as well as garbage. They do a great job in localized recreation. They have the zoning and planning function within local government, and then different governments have different assets. One has a boat basin, another one has a municipal golf course, a host of other different things that represent the way those communities function for their residents. The county has regional functions. We do the regional sewer treatment, the regional bus system, the regional jail, things of that nature. And not every community is going to have a jail. No one community is going to run a whole bus system. Treatment of sewage really ought to be, combined by different communities for cost efficiency. So we do those functions, and it's within those functions that we step forward and we say to the school districts, to the hospitals, and to the municipal governments, we're your partner. We're here to help you. We're not giving you orders. Those orders come from the state down. But at the county level of government, which is a certain sizable government, we are going to help. You may have seen references to how we've operated with COVID CARES money act that we've got from the federal government. And we use that money completely within the rules. But I might add, we use that money to reach out to satisfy needs that came up in certain localities. The newspaper article reflected that Rhinebeck High School had a virtual graduation for which the county was able to host it, and we were able to pick up some of the ancillary costs. That was, in my judgment, an effective and smart use of COVID money because we were in a pandemic situation in which the normal high school graduation was not available. We made that offer to every high school, and those high schools that could accommodate it were interested in it. Some pursued it. One actually did go along with us. We made Playland available for another high school to use, not for the graduation, but for a caravan usage. So we're trying to show creativity and energy and use the resources that the federal government gave to us in a positive light. And of course, you'll be the judge of whether it was a positive light or not. But I think it's important for you to understand from our standpoint, we did these things believing that that is the proper use. And in every analysis of how we use COVID money, it was determined that we operated completely within the guidelines of what we were responsible to do. So I'm very proud that we were able to use resources intelligently and, just as I've said, in concert with hospitals, with school districts, with municipalities, and to do it in a way that allowed us to be able to have some savings and therefore to try to lower the burden of property taxes, county property taxes, on those of you who pay property taxes. Very important. I want to touch on a couple of other items that are non-COVID related. We have quite a miserable day outside the front door if you're watching this in real time. It's supposed to be this way most of the day, and we have had high wind, and we've had a few power outages, all in the Con Edison service area. Con Edison serves about 85% of the county, just below the northern tier of communities. NYSEG does the northern tier of communities. Con Ed provides electric service from that portion all the way down through the border with the Bronx. At the 2 o'clock hour, we had 1,100 outages at this point. Con Edison intends to try to restore power in these outages. The bulk of them have been in Ossining Village and Briarcliff on the Hudson side of the area. 400 plus outages in Ossining Village, 150 outages in Briarcliff Manor. And then on the Sound Shore side, Larchmont experienced 150 outages. These are customer outages, all of which we hope will be reestablished power by the end of the day. And certainly you can follow the information on Con Edison's website. Hopefully from the past storms, they have the communication necessary for you to know what's happening. We want to highlight that while we're going through this, there are still some functions of our Parks Department which continue. We're now into the winter season, and we don't have the same array of parks activities that we would normally have. We had some nice weather over the weekend. It was very busy. We launched our annual Winter Wonderland event, which is at Kensico Dam Plaza. Now, this is sponsorship by the Westchester Parks Foundation, of which the county is a co-sponsor of, but the Parks Foundation is the main sponsor of this, but it's happening at a county park. It is a drive-through event this year rather than a walk-around event. You'll see holiday lights and different other interesting activities, but rather than parking your car in the lot and walking through the event, there's an ice skating rink and all these other things, you'll drive through this. It's a mile-plus route. You're only going to pay by the car rather than by the kid, so it's a little bit less expensive for you. Throw the kids in the back of the car, take a drive through, however long it takes you. You'll entertain them for at least a while, which is nothing, nothing to look at askance. And the Winter Wonderland is really a fantastic little opportunity, something you should enjoy between now and the end of the holiday. 13,000 tickets have already been sold to date, so we're far surpassing our expectations. And while so many things have been down in the society, we've been very pleased that elements of our park operations have been well received in excess of what we thought. Winter Wonderland is one of them. Another one is the Lasdin Train Show, which is a traditional running of a train show at the Lasdin Estate, which is on Route 35 in Somers. You can access Route 35 either from the Taconic Parkway or from I-684. If you live anywhere down county, you can go up there and then turn on Route 35. You'll see Lasdin, not quite halfway between those two highways. And it's a lovely estate. It has an arboretum. It has a veterans memorial setting there, and it has a setup of model railroading trains at the holiday season, which is really very beautifully done. So it's another way to keep the kids occupied. Any out-of-town guests, they want to see something interesting, that's an interesting thing to see. And you can do that at Lasdin. That opens this weekend and will be open to the holiday season. And public golf at our 6 golf courses has had a record year. If you only looked at the county government through the prism of how our golf program was, you would say 2020 was the best year you could have imagined. We have had more rounds this year than any prior year, and I think we can attribute that pretty clearly to the fact that the sport of golf is intrinsically a socially distant sport. We talked about this back in the spring, where you do not physically have contact with the other people that are playing. In fact, you purposefully give them space to putt and to tee off and so forth. And we've had a great response from the community. Our golf courses remain open until the new year. It'll close briefly in the early part of the new year, and then we'll reopen in March. And that period of time, we need to give the greens and the fairways a rest. But the bottom line is the golf courses, 6 public golf courses are open a day like today. You have to really love golf to play golf today. But under normal circumstances, we'll have some good weather over the weekend. You'll be able to enjoy that. So Winter Wonderland, Golf, Lasdin are all open. We also have a public announcement from our public health department. They've done unbelievable work in facing the COVID virus, but they want to make sure that we all understand that the county health department, partnering with Westchester Medical Center Advanced Physician Services, offering free flu shots to residents 7 and older Thursday, Saturday, and Sunday coming up at the Westchester County Center in White Plains. This is free flu shots for residents at the age of 7 and older. Older means all the way up to 107. Free flu shots at the Westchester County Center in White Plains. I got a flu shot a little while ago. We urge you to do the same. A flu shot does not stop you from getting COVID. It helps reduce the likelihood that you'll get the flu. And of course, the last thing you would want would be to have the flu and COVID simultaneously. That would be a very unfortunate set of circumstances. But if you get the flu shot, you reduce the likelihood that you get the flu, and it will also reduce one source of symptoms should you go through those symptomatic situations. There is advanced registration required. I believe we're giving you some information on our graphics here that will tell you where you can go by website. There are appointments that must be made, but this Thursday from 4 to 8, this Saturday from 9 to 3, and this Sunday from 9 to 12, the flu vaccine appointments are open to all, and the county health department believes that that is a good, proper thing that you should put on your list of things to do. So you can have some fun, go to Winter Wonderland at night, beautiful at night, or in the day, go to Lasdin and get a flu shot. Do all of that stuff this weekend. If you like to play golf, you can do that as well. But the seriousness of the COVID outbreak and the expansion of it should not be underestimated. This is very serious times, and we're trying our best to do what we can do. The governor and the state will set the rules for what we have to do in New York State. We will do our best to implement them. working as partners with all of the other players in the game, and hopefully to have a positive impact. I should also mention the Westchester County Board of Legislators is reviewing the proposed budget that our administration delivered to them back on November 10th. They expect to make some final decisions on the budget on December 14th, which is still a couple of weeks away from today. They will have a virtual public hearing coming up. I believe it's on December 9th. If you're interested, go to the Westchester County Board of Legislators website, and you'll be able to find out that information. We are very proud to be able to deliver a budget to the Board of Legislators for the year 2021 that is balanced. It includes a cut in overall property tax levy. It includes a decrease in spending, and we spend money on important social needs from feeding to eviction prevention, our normal round of basic services from buses to sewer treatment, capital projects and the capital project plan, and a budget that we can function under, and we hope in an intelligent way. Hopefully all of that will be done by December 14th. We'll go through the process of review and then sign it hopefully into law by mid-December so that we have a budget waiting for us when January 1st rolls around. With that, we're going to see what questions exist. Catherine Chaffee, our Director of Communications, has received a few. Catherine, what questions do we have?
So the first question comes from Samantha Crawford from News 12. If the trajectory of new COVID cases continues to climb as it has been, or suddenly spikes as it is expected to because of the Thanksgiving holiday, when do you foresee area hospitals facing the problems they faced early on in the pandemic in terms of insufficient numbers of beds and machinery?
You know, Samantha, it's hard to estimate from week to week. We have to look at the growth line that we've had. We talked about the concerns 4 weeks ago, 5 weeks ago, when we were going from 30 cases to 50 cases. And I said, you know, when we hit 100 and we start to rise from there, you know, that really is of concern. We are concerned at this stage of the game. And I think the statistics that I showed you gave you something like an increase over the last 2 weeks of 120 some odd cases. That's a doubling. If they double over the next 2 weeks and we hit near 500 cases, then I think we're all going to start to be extremely concerned. We have 3,000 available beds right now, and we have in the wings 110 units that have never been activated at the Westchester County Center. And there's always been a little bit of chatter out there on Facebook, people commenting, why do we need to do that? Well, we're going to find out if we need it. We have those 100 some odd beds in abeyance. I believe that our system will hold. I don't believe we're going to have hospitalized over 3,100 patients in this area, but we don't know, and we'll have to judge it as we go along. We're monitoring it. We're working. That's the purpose of the call with the hospitals today, and the expectation is, you know, we'll manage it. I think certainly for the foreseeable future, I think the next 2, 3, 4 weeks, our inventory will still be fine. If we see an exponential growth that causes us at the end of 3 or 4 weeks to say, my God, we might exceed the number of beds we have available, then we will move into contingency plans. There was a mandate by the governor back in the spring to require hospitals to add additional beds. They didn't have to use those additional beds, but that was a contingency plan that was put into effect. And I expect that will happen. And then we will start to look at other facilities that might be used, available space for additional accommodations. But I don't think we're anywhere near that. Again, as I don't fear monger, I think right now our inventory is manageable given the amount of need. What we really hope is that everybody who is hospitalized right now recovers and goes home. And by the way, there are after effects. There's no question that people who have survived the COVID attack still are impacted by it in their breathing and their other ways of living. But for right now, I think the system will hold, Samantha. But we will see the rise, and we'll see how steep the rise, and that will determine whether my prediction is right or if it's not right, and time will tell.
Okay. Her second question is, we're seeing around the country healthcare workers who are becoming infected with COVID-19 and cannot work, leading to a shortage of personnel. Are there steps being taken now to ensure that there are enough healthcare workers should this happen here at home?
Well, as we mentioned, the governor today put a call out to all the hospitals to be able for them to go through their database of prospective doctors and nurses to try to get together in abeyance, in a reserve auxiliary capacity, those that might be necessary to help us provide service if this patient base grows even further. We did that earlier this year, and the exact number escapes me. I think we had about 100 plus nurses that responded at the time, and we had some doctors as well. And that's not coming from medical entity basis. We just put a call out to all residents and got quite a number of volunteers that stepped forward. So hospitals are tasked with trying to identify that base. We will certainly be as helpful as we can. We reach out to the New York State Nurses Association, members who may be retired who can come in. And sometimes it sort of fills different roles. There are certain roles where you need a nurse that isn't in direct patient contact, but needs to have the nursing experience to perform a function. If we can bring people back who might be retired to do those functions, freeing up a current active nurse to deal in a patient contact, then that would be the way we get through this. But those efforts have been tasked the various hospitals to do, and the county will step up to make an all-points bulletin as well as we get closer to the actual use of the need.
Okay. And the last question comes from David Proper. Which specific areas in the county could see a new color zone designation? Sorry about that. How are the zip codes doing since landing in a COVID color zone?
Well, David, I think, any of the urban centers that have not yet fallen into a zone are probably candidates for zone designation. We see infection rates higher wherever there are more people and more densely populated areas. Right now, we have Yonkers, New Rochelle as two of our major cities, and Peekskill, which is the fifth city in the county, already designated with zones, and zones of certain size and scope in Yonkers and New Rochelle that are not the whole community. Mount Vernon, White Plains are not in a zone status at this point. Town of Greenburgh is not in a zone status at this point. Those are places we would look at to see what type of growth we had. We do have a couple of villages where we've seen that happen, Portchester notably, which is the most densely populated community in the county outside of the city of Mount Vernon, and the Tarrytown Sleepy Hollow corridor, where we have some similar situations. We have some in Ossining Village as well. I think we're looking wherever else we have concentrated population. Mount Kisco would be one. And we're hopeful that in each of these communities, we're able to stem the tide through public education, through getting out, masks so people wear them and don't convey the disease. But there's so many other issues at hand, and I'll just give you just a footprint on one of them. If you are an hourly worker and you work with your hands, whether you are a waiter in a restaurant or doing landscaping or construction work, you're generally paid by the hour, and you're paid by what you work. There's no guaranteed income. And when you're in a situation where you need the money, you're living, and your family just above a certain minimum level, you're loath to take a test that might tell you that you have to quarantine yourself. So many people in that category are like, I don't feel sick, I'm going to keep working. And while that, might be fine, it might not be fine. And they might have the disease and they might be spreading it. And you're asking people to step forward and voluntarily say, I may have been exposed. I'm going to take a preemptive test to see if I have the disease. And so the more people are in close quarters, the less wealthy people are, the less health care they have access to, the more likely it is that we see the spread of the disease. And we're trying to anticipate that by the actions that we take to drill down, not just let's go to the community center and drop off a bunch of masks. Let's go into an apartment complex and have somebody knock on doors and say, come on, get a stash of masks, get them, wear them, go forward and, follow the rules to the best of ability. And so I think that's what our strategies are. We'll see how well they work. A lot of it still comes down to individuals. I've had this discussion in this forum a couple times before. I don't need to beat it to death, but it's really up to individuals to decide, this pandemic is serious. 1,515 Westchester individuals are dead. When I first gave a little speech about this, it was 1,490. So during that period of time, 25 people have expired who were alive the last time I went through this routine. So I think individuals have to determine what their circumstances are. And, I think a lot of it just comes down to the individual person. We know in our everyday life, which people do we deal with who have sort of a we attitude, they're good friends, they reach their hand out to you in need, and who has more of a selfish attitude. I'm worried about me and mine. Don't get in my way. I'm here to do what I need to do, not for you. We see that when we're little kids on a playground. We see that when we're in a work environment, which other workers are team players, which workers are solo acts. We see that neighbors up and down the street. You have a great relationship with a neighbor on one side of your house. You kind of work the hedges together, and you coordinate when you're having a backyard event. And when you go to the other neighbor doesn't want to talk to you. They'll do whatever they want when they want to do it. This is human behavior. Only we're in a pandemic. It's not whether the hedge gets cut or not. It's whether they wear a mask, whether they go in a bar and spread a disease and have a certain attitude about it. This is my right as an American. And this is a divided country. People have different points of view, and they express their points of view, perhaps now more so than I've ever seen it in my life. And they express their points of view with an edge. Not only am I right, but you're not just wrong, but you're evil. And you're telling me something, and, you get to an edge of relationship where you have to decide you want to have conflict every day. Somebody wants to have conflict with you, but do you want to have conflict with somebody every day? The rules are established not to control you, but to try to control the virus. And you have to decide whether you're going to understand the complexity of this, understand the severity of this, and are you going to modify your behavior, or do you willfully take the attitude, I'm not doing it, I don't care. And that's the individual decision. We have to make governmental decisions for the greater good of the greater number of people, and that's what we're trying to do. So with that, we thank you for your calls. We thank you for watching. We will be back in a couple of days' time. I think Thursday is when we're scheduled. We're doing on Friday this week. Friday, forgive me. We'll be back on Friday to give you an update on the numbers. I would hope that one of these updates, I'll show you that the numbers are starting to recede some. I don't know what to expect. I'll always hope for the best, but we will try to work forward, work with the school districts, work with the hospitals, work with the not-for-profit organizations, corporations where appropriate, chambers of commerce, whatever it is, and to do the best we can as free citizens to address this problem. I'm George Latimer. Thanks for watching. Have a good day. Stay safe, and we'll see you soon.